You know, when you listen to heart murmurs, they can just sound like a confusing mess of whooshes and rumbles. But what if I told you that every single one of those sounds is telling a story? A story about pressure, about blood flow, and about how a heart valve is working or not working. Okay, let's dive in and actually learn how to decode the language of the heart.
Take a look at this. This waveform here is what a heart murmur looks like visually. And trust me, it is not just random noise, it's a signature packed with data. The shape, when it happens, how loud it gets, it all comes together to form a puzzle that points directly to a specific problem with a heart valve. Our goal today? We're going to solve that puzzle.
But before we can even begin to understand what's abnormal, we absolutely have to master what's normal. We need to establish our baseline, a map of the healthy, predictable rhythm of the heart.
And here's our map. You know that familiar lub-dub sound of a heartbeat? Well, that corresponds to S1 and S2. S1, the lub, that's the sound of the mitral and tricuspid valves slamming shut. That marks the start of systole, which is just when the ventricles squeeze and push blood out. Then you get S2, the dub, which is the aortic and pulmonic valves closing. That signals the start of diastole, when the ventricles relax and fill back up. Everything, and I mean every murmur, happens between these two landmarks.
So why do murmurs even happen in the first place? It all comes down to some pretty basic physics of how fluids move. And it turns out every single murmur you'll ever hear is caused by one of just two simple rules.
The magic word is turbulence. Normally, blood flows through the heart smoothly, silently. We call that laminar flow. But when that flow gets all disrupted and chaotic, it creates vibrations. And those vibrations are what we hear with a stethoscope. That sound is the murmur. At its core, every single murmur is just the sound of turbulent blood flow, period.
Okay, so what causes the turbulence? Well, it really just boils down to two fundamental plumbing problems. First, you've got stenosis. The easiest way to think about this is like pinching a garden hose. You're trying to force the same amount of water through a much smaller, stiffer opening. That creates a high-speed, turbulent jet. The other problem is regurgitation. This is just a leaky valve. It doesn't seal properly, so blood flows backward where it shouldn't, creating this chaotic crash of currents. So a narrow doorway or a leaky seal. That's it. That's the cause of every murmur.
Perfect. Now that we have those two rules in our back pocket, let's start decoding. We'll kick things off with systolic murmurs. So these are the sounds that happen between our two landmarks, S1 and S2.
During systole, we really find two main unmistakable shapes. First, there's the diamond, which gets louder, then gets softer. And then there's the plateau, which, you guessed it, maintains a constant intensity all the way through. Each of these shapes is a direct result of the underlying physics.
Let's start with the diamond. This is your classic ejection murmur, and it's caused by either aortic or pulmonic stenosis. So, why the diamond shape? This is the cool part. It perfectly mirrors the pressure curve of the ventricle. As the ventricles start squeezing, the pressure builds, forcing blood faster and faster through that narrow valve. That makes the murmur louder. That's the crescendo. Then, as the ventricle starts to run out of steam, the pressure and flow decrease, and the murmur gets softer, the decrescendo. It's a perfect acoustic fingerprint of that ejection process.
Now, let's talk about the plateau. This is what we call a pansystolic murmur, meaning it lasts through the entirety of systole, and it's caused by a leaky mitral or tricuspid valve. The logic here is totally different. The whole time the ventricle is contracting, the pressure inside it is way higher than the pressure in the atrium it's leaking back into. This creates this massive, constant pressure difference, so blood leaks backward at a steady, high speed the entire time. The result? A uniform, flat, plateau-shaped sound.
So how can you possibly tell these two common systolic murmurs apart? Well, we have to look for other clues. The diamond-shaped murmur of aortic stenosis, for example, famously radiates up into the carotid arteries in your neck. It's also linked with a classic pulse called pulsus parvus et tardus, which is just a fancy way of saying a weak and late pulse, because the blood is really struggling to get out. Mitral regurgitation, on the other hand, it tends to radiate to the armpit, and the pulse feels pretty brisk. These little details are everything.
All right, we've pretty much tackled systole. Now let's just apply that same exact logic to the other half of the cycle, diastole. That's the filling phase, happening between S2 and the next S1.
Diastole has its own unique soundscape. We're mainly listening for two distinct patterns here. A high-pitched, fading sound, the decrescendo, that starts right after S2, and then a low-pitched rumble that happens a little bit later in the cycle. This decrescendo murmur, it's really the sound of failure. Specifically, a leaky aortic valve that's failing to do its job.
Right after S2, the ventricle is relaxing, so the pressure in the aorta is super high. If that valve is leaky, blood immediately starts gushing back into the low-pressure ventricle. That pressure difference is biggest right at the start, which creates the loudest sound, and then it fades, or decrescendos, as the pressures start to even out.
Now, the diastolic rumble of mitral stenosis tells a much more complicated story. First, you have this stiff stenotic mitral valve that gets forced open, creating a sharp opening snap. Then, as blood tumbles from the atrium into the ventricle through this narrowed opening, you hear that low-pitched rumble. And for the grand finale, right before the next heartbeat, the atrium gives one last little squeeze. We call it the atrial kick, which pushes the last bit of blood through, making the murmur briefly get louder again.
And once again, we look for those distinguishing signs. Aortic regurgitation creates this really over-the-top circulation. It leads to something called a water hammer pulse, which feels incredibly strong at first and then suddenly just collapses, all because of that backward leak. Mitral stenosis, on the other hand, is famous for that opening snap, and sometimes it can even cause a malar flush, a kind of rosy discoloration of the cheeks from chronic low oxygen levels.
So we have the timing, we have the shape. But what happens if you're still not totally sure? Well, there's one more layer of analysis we can use. We can actually change the blood flow ourselves.
This is where it gets really clever. We can use simple, physical maneuvers right at the bedside to actually change the hemodynamics of the heart. By making a murmur louder or softer on command, we can confirm what we think is going on. Think of them like little physiological stress tests. There are two really key rules here. First, breathing. When you take a deep breath in, you pull more blood back to the right side of the heart, which makes right-sided murmurs louder. The mnemonic is RIN, right-sided, inspiration, increase. The exact opposite is true for expiration and left-sided murmurs. Second is preload. Squatting literally squeezes blood from your legs back to your heart, increasing the amount of blood in there and making most murmurs louder. Standing up does the reverse, making them softer. It is an incredibly powerful diagnostic tool.
It's really a beautiful system, isn't it? These sounds from the heart that seem so mysterious, they actually follow clear, predictable rules of physics. Once you understand the hemodynamics, you can understand the murmurs.
And to bring this all home, here is the master synthesis matrix. This is your cheat sheet. It combines the valve problem with its timing, its classic shape, where you hear it best, and its single most defining feature or maneuver. This is how you take all those individual clues and build one confident diagnosis.
So now you have the framework. You have the tools to listen to the heart's story. Thinking back on everything we've just covered, which murmur's signature pulse do you think is the most revealing clue? The one that almost immediately just gives the whole game away. It's a great little thought experiment to test how well you can connect these sounds to the rest of the body.